Hello everyone, in today's video I will be talking about shock, types of shock, and I will be explaining hypovolemic shock in detail. Shock is a life-threatening clinical syndrome of cardiovascular collapse which is characterized by acute reduction of circulatory blood volume and inadequate perfusion of cells and tissues. Whenever there is inadequate perfusion of cells and tissues, it will lead to hypoxia, cell death, eventually organ failure, multi-organ dysfunction, and death. There are many types of shock which include hypovolemic shock, cardiogenic shock, obstructive shock, distributive shock, anaphylactic shock, septic shock, and neurogenic shock. In today's lecture, I will be talking about hypovolemic shock. Hypovolemic shock is a form of shock which is caused by severe hypovolemia, which means insufficient blood volume or insufficient extracellular fluid in the body. The causes are hemorrhagic and non-hemorrhagic. The hemorrhagic cause include acute blood loss due to GI bleed, rupture of aortic aneurysm, any trauma or any surgery, postpartum hemorrhage, ectopic pregnancy, hemoptysis as seen in pulmonary embolism, etc. The non-hemorrhagic causes means fluid loss cause, and the fluid can be lost from the body by dehydration due to diarrhea or vomiting, due to burns or excessive use of diuretics. As we know that the blood pressure is dependent on vascular resistance and cardiac output. The cardiac output is dependent on heart rate and stroke volume. Stroke volume is the blood ejected by the left ventricle per beat. The stroke volume is calculated by the formula end diastolic volume minus end systolic volume. In cases of hypovolemic shock, when there is loss of more than 20% of the whole blood in the body, the hypovolemic shock ensues. Because of low blood volume, the filling volume or the end diastolic volume is low in such patients, because of which there is decrease in the stroke volume, and when the stroke volume is decreased, then the cardiac output will also decrease, and whereas decrease in the cardiac output, the blood pressure will also decrease. The hypovolemic shock has three stages: a non-progressive stage, a progressive stage, and an irreversible stage. The normal circulatory compensatory mechanism eventually cause full recovery without help from outside therapy in the non-progressive stage of hypovolemic shock. In this, the baroreceptors in the arteries detect the hypotension and cause the release of epinephrine and norepinephrine. The norepinephrine causes vasoconstriction with a mild increase in heart rate, and epinephrine causes an increase in heart rate with a small effect on the vascular tone, and the combined effect will be an increase in the blood pressure. The renin-angiotensin axis is also activated, and antidiuretic hormone is released to conserve the fluid by reducing its excretion via the renal system. In the progressive stage, it is reached when the underlying cause of the shock is not successfully treated and the compensatory mechanism began to fail. In this, without therapy, the shock worsens until death. In progressive stage of hypovolemic shock, due to decreased perfusions of the cells in the body, sodium ion build up within the intracellular spaces, whereas potassium ion leaks out. Due to lack of oxygen, cellular respiration diminishes and anaerobic metabolism predominates, which causes lactic acidosis. As the anaerobic metabolism continues, the arteriolar smooth muscle and precapillary sphincter relaxes so that the blood remains within the capillary. This will cause an increase in the hydrostatic pressure, and combined with histamine release, it will lead to leakage of fluid and protein into the surrounding tissue. Because of this leakage of fluid, the blood concentration and the viscosity increases, causing sludging in the microcirculation. The prolonged vasoconstriction will also cause the vital organs to be compromised due to reduced perfusion. In the irreversible stage, the vital organs have failed and the shock can no longer be reversed. In this, the brain damage and cell death are occurring, and death will occur imminently. One of the primary reasons that shock is irreversible at this point is that much of the cellular ATP has been degraded in the absence of oxygen. The symptoms and signs of hypovolemic shock. The most common symptoms of hypovolemic shock are anxiety or agitation. The skin will be cool and clammy. The patient will experience confusion. The urine output is decreased or there is no urinary output. The patient will feel weakness. His skin will be pale colored. There will be rapid breathing. He could experience sweating and he could also fall unconscious. When the physical examination of such patients are done, there will be low blood pressure, low body temperature and rapid pulse, which is often weak and thready in such cases. For the treatment of patients with hypovolemic shock, an intravenous line will be put into the person's arm to allow blood products, or isotonic crystalloid fluids. Medicines such as epinephrine or norepinephrine may be needed to increase patient's blood pressure and cardiac output. Please do subscribe to the channel if you're liking the content.